All right. Well, thank you very much, everybody, for joining us today. My name is Emily Clark. I'm a knowledge broker at the National Collaborating Center for Methods and Tools. I'm very excited to be joining a number of colleagues today for our webinar on evidence-informed decision-making methods and tools for students in public health programs. A couple of things to go over real quick. We are testing a new webinar platform. You've probably noticed we're logging on through BigMarker. This is one of our first times using it, so bear with us if there are any hiccups, but we think we've worked out most of the kinks. If you do have any connection issues, we do recommend that you use a wired internet connection if possible, realizing that a lot of you are probably at home on your Wi-Fi. If you are having any technical issues, you can send a private message to an admin listed as National Collaborating Center for Methods and Tools. If you send a message, then we will get back to you right away with some troubleshooting advice. You can use the chat to post questions or comments throughout the webinar. If you post your questions, we will address them right away if we can, or save them for the end. We do have about 15-20 minutes reserved at the end for your questions and comments. So feel free to post those throughout and we'll address them then, or to save them up for the end. And then again, the technical difficulties, please keep those out of the main chat if you can, and send those to the admin. During the presentation, we will have a number of polls, mostly so that we can get a sense of who's joining us today, where you're all coming from, and get you interacting with us a little bit there. So we'll make sure that we go over how the polling works at that time. But the questions will be popping up for you. You can select your answer and then just be sure to hit the submit button so that your answer gets recorded. After today, you can access the recording, which will be in English, as I'm speaking in English, at our YouTube channel, and slides will be posted in both English and French at our SlideShare account online. That should probably be up within the next week or so. So what we're going to cover today, I will very, very briefly talk about the NCCMT, the other NCCs, and our network of national collaborating centers. I'll talk a little bit about what evidence-informed decision-making is, why you should care about it, and then what we thought with this webinar, and we've been doing this webinar now for a couple of years, is rather than hear me talk about, the things that NCCMT has to offer, we're bringing in some students and recent graduates from public health programs to talk more specifically about the resources that they used, both in their coursework, now that they've graduated and are working, what they have found useful, things that they wish they had had while doing their coursework. So getting that real unique student perspective where they can share how different resources would have been or were particularly helpful for their specific programs. And then we'll wrap it all up with a Q&A and a discussion. So this is hopefully going to be really just a great conversation with a number of different presenters. And get you familiar with what's out there and hopefully get you interested in learning a bit more. So our objectives for today. So we're hoping that by the end of this, you'll be able to talk about the key features in a model for EIDM, or evidence-informed decision-making, talk about the process for evidence-informed public health, know where to find tools and resources that can support you or colleagues in public health to find and use, so make them actionable, the best available research evidence. And then gain some perspectives from current and recent public health grad students on the value of some of these tools that they have found helpful both in their coursework, in practicum work, and in their early careers. So just to get started, we want to get a sense of who is with us today. So the first polling question is, what is your role? We've listed here whether you're an undergraduate student. We know there are actually a couple of MP or undergraduate level public health programs now in Canada. Whether you're a graduate student, whether you're program faculty looking for some resources to help support your students, or whether you're joining us from a different role. So please take a moment and hit submit so that we can get your answers. And it looks like the majority of people joining us, about 80 some percent, are graduate students, a couple of undergrads, a couple of faculty, and a couple of other. So really great to have you here. Wishing you all the best in your studies right now, especially as everything has really been tossed open by this pandemic. So really glad to have you with us. I'm going to close this poll, and our next question is just to get a sense of the audience that's with us. How many people are joining today's session with you? This question, we were realizing as we put this together, is a little bit less relevant, as many of us are now working and studying remotely from home and are likely alone. But we just wanted to make sure that we give you an opportunity to say. It looks like pretty much everybody is joining on your own. For those of you that are in groups, we do hope you are doing so safely. So thank you so much for your answers there. And then have you previously visited the NCCMT's website or used our resources? So this helps us tailor our presentation just a little bit in terms of what level you may be at and what level of familiarity you may have with some of those resources. And then we know really how in depth to go with these. So it looks like about 2/3 of you are familiar with our website and resources, which is really fantastic to hear. For those of you who are new to NCCMT, we're really glad to have you. Really hope that we can get you excited about some of the tools and resources that we have today, as we hear from some of our co-presenters. And next, we're wondering, how often have you used NCCMT resources or accessed the website? Maybe only once you've tried one of our tools, whether you've used it more frequently than that, or whether you're a repeat user that's often coming back. So this helps us gauge, again, where our audience is at in terms of your familiarity with our resources and products. Looks like we have a couple people who have just dabbled once or 2 or 3 times with our products, and a couple of, I would say, super fans who are at 10 or more times. So really happy to have you all here, and again, hoping to get you excited about some of the resources that we have to offer and applying them in your own work. So just as again, a very brief introduction to who we are and the work that we do. So the National Collaborating Center for Methods and Tools is actually one of 6 national collaborating centers that's located across Canada. All 6 of us were located or hosted by different institutions, some of us at universities and some of us at public health institutions like INSPQ or the BC CDC. And while we're all hosted at different locations across the country, we all act nationally in scope. The other 5 NCCs focus on specific topic areas in public health. On your screen, you can see we have a Center for Indigenous Health, infectious diseases, determinants of health, environmental health, and healthy public policy. And those are then the 5 main focuses of those national collaborating centers. And here at Methods and Tools, we focus on resources and training and methods and tools that can support evidence-informed decision-making in all topic areas within public health. All of us have a mandate to support public health across the country. We were actually founded, funded by the Public Health Agency of Canada, and founded immediately after the SARS outbreak in Toronto over a decade ago now. At that time, it was realized that during a time of crisis, during an epidemic or a pandemic, we really needed somebody or an organization that can support public health, that is arm's length from government bodies, who can be nimble and respond quickly when things happen, when there are crises in public health. So a little bit timely introducing us now, given the COVID pandemic, and each of the NCCs does have contributions that we've made to the COVID-19 response, and we'll chat about those a little bit later today. So what is evidence-informed public health? Why does it really matter? So we've defined it formally as the process of distilling and disseminating the best available evidence from research, context, and experience, and then using that evidence to inform and improve public health practice and policy. Simply, it's finding, using, and sharing what we know works in public health. This can be very important. We often find that, especially in some of the outreach that I do as knowledge broker, we often have people saying, "Wait, aren't we already doing this? Isn't everything that we do evidence informed?" And a lot of people don't realize exactly what being evidence informed truly means. They're thinking that, if there's something that you want to do and you can find a research study to support it, or a research study that shows that something works, well, there you've got some evidence to inform what you're doing. When really what we're looking at with an evidence-informed approach is that in that process, and we'll get into this again a bit later, in that process you are looking at all of the evidence, evaluating the quality of that evidence, and then using that quality to inform what decisions you actually make. So it's not just finding, using Google to find a study that supports something that you already wanted to do. It's looking at all of the evidence and using that evidence to make then an informed decision for your public health question. Oh, where's our slide? There we go. So very, very brief introduction to our presenters. I will let them introduce themselves as well. But I'm very excited to be joined by 4 co-presenters today. First of all, we have Emily Windsor. She graduated from McMaster University. She did a practicum at the NCCMT and has since moved on to Cardiff and is working at Cardiff. Andrea Cooper currently works at Ottawa Public Health and is completing her Master's of Public Health at the University of Waterloo. Andrea works as a public health inspector and actually completed one of the training programs at the NCCMT. Rachel Jansen and Alana Miller are both currently working for the NCCMT. Rachel started as a practicum student with us, and we just couldn't let her go. And both Rachel and Alana, Rachel's finishing up at McMaster, and Alana just recently graduated from McMaster University. So they were in separate cohorts, but I will let them introduce themselves as well. So the first question that we wanted to ask our recent grads and current students is, how are evidence-informed decision-making skills important in either your studies or in your work in the public health field? And then what we're going to do after we do a bit of a roundtable with that question is, what's a resource that you have found useful? So starting out with, how are those EIDM skills important? Talk a little bit about the work that you're doing and how the EIDM fits into that. So I will let everybody go around, and I'm going to open it to our co-presenters now.
Sure. So I'll go ahead and get us started. So my name is Alana Miller, and as Emily had said before, I am currently a research assistant with the National Collaborating Center for Methods and Tools. So I completed my undergraduate degree at McMaster University in life sciences, and I also did my MPH at McMaster, and I graduated just this past July of this year. So I am a very recent graduate, and not very long ago, I was definitely in the same position as all of you, or most of you, I guess. So I really hope that today you guys will be able to learn something new from this webinar, and we'll leave today with a better understanding of evidence-informed decision-making and how you can use the NCCMT's tools in evidence-informed decision-making and in public health. So how are EIDM skills important in my studies or in my work in the public health field? So, as it's been mentioned, I am a research assistant with NCCMT. And right now, the projects that I am working on are working on developing a couple systematic reviews related to the COVID-19 pandemic. So, systematic reviews are definitely one product that is really rooted in evidence-informed decision making. So, for those of you who aren't familiar with a systematic review, it's really about searching for and combining all of the evidence on a certain topic and appraising that evidence and synthesizing that evidence to answer a specific research question. So, pretty much the core responsibilities as my job as a research assistant is to use evidence informed decision making and to generate these systematic reviews, which is a product that public health professionals working in the field can actually use and apply to their work as well. But yeah, I'll go into further detail with some of the specific products that I've used and how those relate to evidence-informed decision making. But I guess I will pass this along now to Emily Windsor, and she can talk about her experience.
All right, thank you, Alana. So before I get started, I would just like to recognize today that I'm speaking to you today from Ottawa, which is located on the unceded territory of the Algonquin people. So I'll first start off with speaking a bit about my background. So like Emily Clark mentioned, I'm an MPH graduate from McMaster University, and I graduated last December. So it's been a big time of shift in public health right now, but I'm lucky to start working in the field of public health at a very exciting time and changing time during this pandemic. And before my MPH, I completed my Bachelor of Science in Environmental Science at McGill University. And during my MPH, I completed 2 practicum placements. So the first was at Public Health Ontario in the Environmental and Occupational Health Department. And then second, as Emily mentioned, was at the NCCMT, where I met a lot of these great folks that you'll be hearing from today. So then after graduation, I continued at the NCCMT part-time as a research assistant. And just recently, I've moved on to another exciting position at CADIS as a pharmaceutical review assistant. So how are EIDM skills important in my studies and work in the field of public health? So I'm going to touch more in detail on specifically my role with my current position and past positions when I speak to the specific tools that we'll be looking at today. But briefly, it has been very important to both my studies and my career in public health because the skills I've acquired through the use of these EIDM tools and methods have allowed me to broaden my global understanding of public health. So it's allowed me to discover how scientific evidence informs policymaking, which may be very interesting to some of you, but also how it can influence the public health agenda. So it's been fundamental to my overall understanding of public health. And then it has also allowed me to look at public health with a more critical lens. So to understand how public health is connected to the local, political, and also the clinical spheres. So with that, I will pass it on to Rachel.
Thanks, Emily. So my name is Rachel. I am currently a second-year MPH student at McMaster University. I'm going to be graduating this December, as long as everything goes to plan. I completed my practicum with the NCCMT this past summer, and like Emily Clark mentioned, I've been lucky to remain with the NCCMT as a part-time research assistant. So I've been able to continue to work on several projects, which has been a really great experience. My education and professional background is in nursing. So I completed my BSCN at McMaster in 2013, and I worked as a registered nurse at St. Joseph's West Fifth, which is a psychiatric inpatient hospital here in Hamilton, from 2013 until very recently, when I've made the decision to really shift my career focus to public health. So how are EIDM skills important to my studies and work? Just going back a little bit, I was exposed in a bit of a different context to EIDM during my nursing education at McMaster. And I can incorporate parts of it into my work as a nurse, but it was not generally explicitly outlined in any kind of like EIDM framework during day-to-day work. But for an example, the idea of incorporating resources into decision-making was a really important consideration for patient treatment plans because medications are covered in hospital, but a lot of people can't afford to purchase medications out of pocket. And so their individual health plans or lack thereof needed to be considered when they're discharged from hospital and need to continue ongoing treatment. So overall, before beginning my MPH, my experience with EIDM has been more so at the individual level. So now going through my MPH courses and my practicum and my ongoing work, I feel like my overall understanding of EIDM has expanded, and I'm still learning how these concepts can be applied widely to entire communities or populations. Overall, I feel like I'm able to better consider a situation or problem in a more comprehensive way and tease out details and nuances that might not be obvious at first glance. And to me, considering all the components of EIDM can become a bit complex and sometimes overwhelming because it feels like the more you know, the more questions that come up. And maybe some other students can relate, but I often find that as soon as I get kind of comfortable with a concept or something I've learned, very soon all those nuances and complications of that concept are revealed, and I realize I have a lot more to learn. So as an example, like in our MPH courses, we learn about the hierarchy of research evidence, and in biostats, we learn about magnitudes of effect and whether they're significant or not. And so just as we get a handle on those concepts, we learn that findings, say, like Emily mentioned, a systematic review that shows an intervention is effective, that's only one very small part of starting the process of potentially using that information. So it's been a lot of learning, and I'm really excited to learn about all these resources with everyone else about how to use EIDM in our studies and work. So I'll pass it over to Andrea.
Thank you. So my name is Andrea Cooper, and I'm a public health inspector at Ottawa Public Health. I've been working in public health for about 8 years now. My current role is actually not as a health inspector, and I'm working as a supervisor on the school and childcare outbreak team for COVID-19. So that is rapidly evolving, and I've been using evidence-informed decision-making greatly in that role. I did my Master's of Public Health at the University of Waterloo. So I did the 4-year part-time program while I was working, and I actually graduate in 2 weeks. So on October 24th, so that's exciting, and we'll be doing a virtual ceremony. I also participated, as Emily said, in the National Collaborating Center for Methods and Tools Knowledge Broker Program from January 2017 to June 2018. So that was my first introduction to evidence-informed decision-making. And in that program, we had the ability to practice doing a rapid review for the first time. And that was very eye-opening to the importance of using evidence and also the process that goes into it. I also did my practicum for my Master's of Public Health at Ottawa Public Health in evidence-informed decision-making. So it all kind of came full circle for me from January to March this year. And for this question, how is the evidence-informed decision-making skills important to my studies and work? So for me, as the name claims, evidence-informed decision-making truly helps to inform decision-making in public health. This is important when we are working at a public health unit, as I do, as often staff, operators, key stakeholders, such as Board of Health members, have questions for us that include a certain level of evidence in their answer. The process of using evidence-informed decision-making, both in our studies and at work, promotes the ability to use the best available evidence in the most efficient way. This leads to increased confidence and credibility in our actions and outcomes. For me, this is an extremely important practice as it ensures you are making the best use of your resources. Specifically in the school environment and at work, this resource is time. Time is a very valuable input when using evidence-informed decision-making. You can ensure you are using the best use of your time to effectively produce your results and deliverables for your clients. And I'll pass that back to Emily.
Wonderful. Thank you, everybody. It's so great to hear about what you have done and how your career paths have landed you where you are now. Congrats, Andrea. I didn't realize your graduation was quite so close. That is really, really exciting. So moving on, what we're going to talk about now are some resources that our co-presenters have found useful during their careers. So the way that we've structured this, we all met prior to this and we talked about some of the resources that had been found helpful. And we do have a couple of slides prepared so that you do have a visual as well. So we're going to go through 2 rounds. Through each of our presenters, we'll have an opportunity to present 2 of the different resources that they have found particularly useful during their school and work careers. So without any other hesitation, I'm going to jump in to handing it over to Emily Windsor to talk about the Evidence-Informed Public Health Wheel.
Thank you, Emily. So yes, I'll get started with this resource. So before I kind of get into the depths of it, I just wanted to stress that you can find this resource on the NCCMT website. And also, maybe not right now because of COVID and everyone working from home, but the NCCMT does have this printed out in the office. And it was very helpful to me to have it printed out and see it in front of me and be able to look at the different steps of EIDM and be able to shift kind of the wheel at the specific step I was looking at. So hopefully in the future, when we're back in the office or we're back in person, if you are interested in getting one of these printed out, it's been very helpful and pivotal in my public health career. So to explain a bit about the wheel here, it's a great tool when you want to learn about the 7 steps of the EIPH process. So as you can see on the slide, the 7 steps are highlighted here. We can start with defining our research question when we're, for example, writing a rapid review. And then we can go around the wheel to every specific step. So appraise, for example, would be appraising the relevant literature. Synthesize would be to synthesize the data from the literature you have found. And then at the end, we can go to evaluate, which would be to evaluate some of the literature you've found or evaluate a program that you may have implemented, for example, a nutrition program. So as a professional, I've referred back to the diagram and the steps of EIPH often. So at the beginning of my career and as a student, especially at the NCCMT and Public Health Ontario, a lot of what I was appraising and synthesizing and searching for in evidence-informed public health was more interventional studies. So as I'd mentioned earlier, maybe looking at a nutrition program and how that may influence dietary habits in a certain population. So now working as a pharmaceutical review assistant, I'm appraising, synthesizing, and searching more for clinical studies. So I specifically work in oncology, which looks more at randomized control trials. And while I've learned the EIPH process with this tool, the understanding whether I'm looking at an interventional study or I'm looking at an RCT, the skills that I've learned are transferable between the two. So, for example, an RCT or a more epidemiological research that I'm looking at versus an interventional study, I'm going to be appraising it maybe a different way. So there's different tools, some of you may know, for appraising a randomized control trial versus a different tool that's used for appraising a systematic review or a meta-analysis. But the process that I've learned through using this tool has made it so that a lot of the understanding is transferable, and I can understand how the process of EIPH fits into a bigger picture. So with that, I'll pass it back to Emily Clark.
Awesome. Thank you, Emily. And now we're going to hear from Andrea on our model for evidence-informed decision-making in public health.
Perfect, thank you. So there are 5 important areas used to inform evidence-informed decision-making that you'll see in the diagram on the screen here. So they are community health issues in local context, community and political preferences, research, public health resources, and public health expertise. So I use this in my everyday decision making at work. It is always a key part of decision making and reminds us to look at all aspects of evidence that influence our decisions and critical thinking. It's important to recognize that evidence is not simply limited to research. Although research is very essential, it's also important to consider the local context. What this includes is, what's your community facing at this time? What are their specific needs and barriers? It's important to consider the political preferences, the resources available to you and your colleagues, and most practical and of high importance is the public health expertise available to you. This includes what you know and what your experiences have been. What have you learned? What have your colleagues learned? What do your colleagues and classmates know that can be used to inform your decision-making process? Although we discuss evidence at work, we always start by discussing the evidence-informed decision-making model in total in order to remind us of what goes into each decision and to what amount. It's important to consider that depending on the circumstance, one area of the evidence-informed decision-making model may significantly outweigh another, and one might not even be used at all depending on the decision you're making. This is completely okay as long as there's awareness of the bigger picture at hand. Hand it back to you, Emily.
Perfect. Thank you so much, Andrea. And now we're going to hear from Alana on the NCCMT Registry of Methods and Tools.
Thank you, Emily. So the NCCMT has 3 repositories available on their website. One of these is the Registry of Methods and Tools, which is a searchable online collection of evidence-informed methods and tools for knowledge translation in public health. I've posted just now the link in the chat. So if you guys want to just access this resource now, you can kind of see what it looks like. So the registry includes products that help you access or use information for decision making. And the registry identifies and describes methods and tools in summary statements and then provides links to those sources. So the registry was first created in 2007, and potential registry resources are identified through conferences, presentations, newsletters, meetings, and external networking events. Currently, there are 66 tools, 66 methods, and 86 tools on the registry, so a total of 152 different resources. And these tools are not all created by the NCCMT, but are from countless different sources. So you can access the registry directly from the NCCMT's website, or you can use the link that I just provided in the chat. From there, you can search the registry using keywords, and you can refine your search based on the type of resource you are looking for, so either a method or a tool. You can also refine your search by the step of evidence-informed decision-making you are in. So whether you are looking for a resource that will help with implementation, evaluation, adapting evidence, synthesizing evidence, searching, appraising evidence, or for knowledge translation. The registry is a great resource that you can use to help you identify other resources that you are looking to incorporate into either your school assignments or your public health practice. For example, if you are looking to create, say, like a logic model for an assignment or for a public health program you're looking to implement, you can simply just search logic model and it will show you a list of different tools. Another example is if you are looking to critically appraise any kind of evidence, you can select the appraise filter and it will show you all of the appraising tools that are available. So the registry is a resource that I was not aware of while I was a student, but hopefully all of you can get a chance to access this resource and incorporate it into your assignments or your practical work. Also featured on the registry webpage is a user stories tab where you can actually read real life experiences of other practitioners and the methods and tools that they have found useful in public health practice. So I definitely encourage all of you to look into this resource. It's going to show you a bunch of other resources that hopefully you guys can work and use when you start your public health careers. Okay, and with that, I'll pass it back to Emily Clark.
Awesome. Thank you so much, Alana. Registry is such a great resource for finding even more resources that can help you with your work. So next, we're going to hear from Rachel about our Understanding Research Evidence videos.
Great. So this is a resource that I've actually used quite a few times. So NCCMT has a series of these Understanding Research Evidence videos on their website. They're short explanations of various research evidence concepts presented by NCCMT's scientific director, Maureen Dobbins, and they're all presented in a really clear and approachable manner. There's a total of 11 videos. They all only run about 5 to 10 minutes long, and topics include how to calculate or interpret things like relative risks, odds ratios, confidence intervals, forest plots, and several others. So I have found these measures, specifically about measures of effect, really helpful during my biostats and intro to epidemiology courses when I was learning about these concepts for the first time and completing homework and assignments about them. I've also gone back to them since to refresh my knowledge, specifically to prepare for practicum interviews in the winter term, and again this term to help with a knowledge synthesis elective that I'm taking. I also really like that there are videos that move beyond only statistical effects, and they do discuss some EIDM concepts at a higher level. So one video outlines the same EIDM framework described by Andrea a few minutes ago. There is also a video titled The Importance of Clinical Significance, which helps to broaden the understanding of research evidence and determine if studies have kind of a real world or practical importance beyond just statistical importance. This video also touches on important EIDM concepts like considering what resources would be required to implement an intervention. I find when I'm learning new concepts, it helps to have it described in more than one way. And these videos really break down complex topics into simpler components, and they provide really tangible examples to illustrate the content. I think they're a really great complement to materials learned in class, and they have definitely helped me study for tests and complete assignments. I think that looking for video tutorials to help understand a concept is pretty common now among students, and there are obviously a ton of resources available online. I really like knowing that these videos in particular are produced by an established and trusted public health organization like NCCMT. And so I'll send it back to Emily.
Awesome. Thank you, Rachel. I'll be the first one to admit that every time I come up against one of those concepts like standardized mean difference, I'm always watching a couple of minutes of the video to remember exactly what that means. So that's fantastic. Next, we're looking at our online learning modules, and I think we're going to hear from Alana and Emily Windsor.
Okay, so the online learning modules are probably my favorite resource on the NCCMT's website. I've been using them. I started using them back when I was an MPH student, and I still use them today when I just need a refresher on a topic. So available on the NCCMT's website are 12 free online learning modules, which cover topics on all aspects of evidence-informed public health, including an introduction to evidence-informed decision-making, searching for evidence, critical appraisal, assessing the applicability and transferability of evidence, implementing knowledge translation strategies, and evaluating knowledge translation strategies. These modules are freely available for anyone to access. You just have to create a login account and password, and you will earn a certificate of competence from the NCCMT for each module that you complete. These modules are great for students looking to learn about evidence-informed decision-making or for those whose focus is on professional development. So one of the modules that I found specifically useful was the module titled Searching for Research Evidence in Public Health. When I was completing my master's thesis during my MPH, I needed to conduct a literature review on my research topic. And prior to this, I had very limited research experience. And this module really helped me to formulate my research question, identify some of the sources of information, and develop a comprehensive search strategy. So this module specifically will review the PICO format of a research question. So for those of you who aren't familiar with PICO, it stands for population, intervention, comparison, and outcome. And it also goes into how you can use this PICO format to actually develop your search strategy. The module also reviews the 6S search pyramid tool, which will help you find the best available published research quickly and efficiently, starting from the top of the pyramid, which looks at the most synthesized evidence, and working your way down to the single study level. And also this module reviews different databases that you can use for public health, that you can search for public health related evidence, including databases where you can search for gray literature that you may just not be as familiar with in your previous studies. So I've also found the module on critical appraisal to be useful, especially now in my current role where one of my duties is to appraise evidence. So as a research assistant with the NCCMT, part of my job involves critically appraising evidence. And there are several different critical appraisal modules available. So there are ones that focus on the critical appraisal of guidelines, systematic reviews, qualitative studies, and intervention studies. And each of these modules reviews what aspects of each type of evidence are important to consider when determining the quality of that evidence. And each module will also identify specific critical appraisal tools that you can use with those types of studies. Being able to critically appraise evidence and understand what criteria are needed in a strong piece of evidence are very important, especially when there's so much evidence available out there. I believe that critical appraisal is definitely an advantageous skill to have when entering the public health workforce, and I definitely recommend using these modules. So definitely check out the 12 online learning modules that are on NCCMT's website. All of the modules include examples where you can actually work through and apply what you've learned. And so it really is a great learning experience. And once again, they are all free to access and they only take about 1 to 3 hours to complete. So this is definitely something you can do in your spare time to just better your understanding of evidence-informed decision making. So back to Emily Clark.
Awesome, thank you. And next we're going to hear from Andrea about one of my personal favorites, the health evidence database.
Thank you, Emily. All right, so the health evidence database is something that can be used heavily in your evidence-informed decision-making process. The database only indexes synthesized evidence on public health intervention. This means that it includes reviews that take all of the findings from individual studies and bring them together into evidence for an overall result or recommendation. This will save you time when looking at all the individual studies yourself. Not only is the evidence synthesized on the health evidence database, but it's also appraised for quality by the health evidence team. So that was something that was just mentioned in the previous slide. So not having to do that yourself will save you significant time in your process. Critical appraisal of reviews is important as it allows you to judge whether a review was done well enough to inform your decision making. It helps you assess whether the review authors conducted a thorough enough search to be confident that they have found all the evidence for the intervention and whether they weighed the evidence by quality when synthesizing their overall findings. You can use the advanced search function on this health evidence database to look up specific populations. So you can freely limit this to things such as children, adolescents. You can also limit it by intervention type, so behavior modifications or by built environment. You can also create your own individual account on the health evidence website. From here, you can select topics that you're most interested in. then you will be able to receive an email each month with the latest reviews added on these topics of your individual interest. All of these will obviously, as was mentioned above, be pre-appraised for quality, which is a huge advantage.
Thank you, Andrea. Oh, and we're going to hear a little bit more from Andrea about searching these types of databases.
Thank you. So this is a tool that I wasn't necessarily familiar with during my MPH, but became very familiar with when working with the librarian. So Boolean operators are basically universal words that can be used to pair, connect, or phrase together multiple search terms in a way that a search database will understand and be able to formulate into a search result. It's kind of like a way of writing a sentence that only a search engine can interpret, and it can use that to refine or expand your search. Given that the operators all offer different needs, they can be picked and chosen depending on what you're looking to find. As you'll see in the slide, some can be used to narrow your search. Example, using AND will only bring back results with 2 search terms together, or it can be used to expand your search. So by using OR, it will return search results from any of your search terms, either paired together or apart. And if you chose to put the operator not in your search, it will limit your search to not include certain terms. Boolean operators and search symbols are helpful to help target your search to what you want in order to avoid getting tons and tons of unrelated articles and reviews returned. I personally use this most frequently when I'm doing a search for a time-sensitive item. So this can be used for your school projects or at work, something where you won't necessarily be engaging with the librarian to do a wholesome search. But just a note on that topic is that when working at a health unit or even through your MPH program, the designated librarian to your organization is hands down the most valuable resource, in my opinion, available to you. I find these tools make the search feel less overwhelming and can actually bring back results faster. My overall learning is that it's better to put the work in from the outset and use the Boolean operators and common search symbols and document the different search terms and sequences you've tried. This seems somewhat overwhelming, but trust me, it will save you significant time in the overall process, especially if you track what you've done in case another team member joins you halfway through your search, or if you decide to report on your findings on the outset. This will be very important for your methods section. It's important to note that different databases have their own Boolean operator rules. So although these are generic operators, some Boolean operator assumptions can change when you're using a different website or search engine. Usually this is specified on the database page, so be sure to check that out before you start your search. Symbols are the same way. They can sometimes be used with interpretation and slight variance, depending on the search engine you're using. But again, a librarian is a great resource for you to help you understand these. And if time's on your side, it's interesting to just play around with them on your own and see how drastically they can change the returns of your search results. And I'll pass it back to Emily.
Awesome. Thanks, Andrea. These are so important. We've really noticed that we've been doing some searching in some of the COVID databases, and some of these databases are new enough that they don't actually read Boolean operators, and you really miss them when you don't have them. So thank you so much for sharing that, Andrea. And then next, we will hear again from Emily Windsor about the Rapid Review Guidebook.
Thank you, Emily. All right, so I'm going to send the link to the Rapid Review Guidebook in the chat so that you can maybe look at it while I'm speaking or refer to it afterwards. So I'd just like to stress how important this guidebook was to me, both as a student and professionally now. It's very clearly written and just very easy to follow along. So a rapid review is different from a systematic review, as they're a process that follows a shorter period of time. The Rapid Review Guidebook details each step of the rapid review process, and it will guide you through writing the final report. So as you can see on the slide here, we do see that EIPH wheel again, as both I was referring to earlier and then Alana was referring to in the modules. So the Rapid Review Guidebook follows this and shows you exactly how to define a research question in depth, search your literature, synthesize it, and so on. So it's been very helpful. And I'm going to speak to a few examples where I've used the Rapid Review Guidebook. So as a student, I worked on a rapid review with a professor at McMaster, and we were updating a review that had previously been done with new literature. And the review was on how to measure the quality of life and happiness at the community level. So as a new student in the public health program, I didn't have a lot of background in understanding systematic reviews and meta-analyses and all of that, or specifically what a rapid review guidebook or rapid review was. So what helped me was to look at the Rapid Review Guidebook and get a better understanding of what I was working towards. So this was very helpful in that aspect. And secondly, I'll also send a link to this after I finish speaking, but on the NCCMT website, you'll notice that we've done rapid reviews for different topics on the COVID-19 pandemic. So one example would be that we looked at how long the virus lasts on copper surfaces and things like that. So if you haven't checked it out, I would really recommend doing so. But before I started working on this project and doing searching for COVID-19 topics, I referred back to the Rapid Review Guidebook just to get an idea of exactly how to search for the relevant literature with our exclusion and inclusion criteria. And it also made the process of looking for relevant literature and understanding the synthesizing of data much easier. And then with those two examples, I'd also like to stress that while you may be able to follow along the Rapid Review Guidebook while you're writing a rapid review, I think even if you aren't doing a rapid review, I think it's very important to read because you can reciprocally think about it as the more you understand each specific aspect of a rapid review, it may be easier when you're reading a rapid review or certain literature that you may find. So being able to understand exactly how it's written and every single part of it has made it easier for me as well when I'm searching for literature or just reading a rapid review to get an understanding of the process. So with that, I'll pass it back to Emily Clark.
That's wonderful. Thank you so much. And then the last resource that we're going to hear about is going to be from Rachel.
Thanks, Emily. So this resource is obviously a bit less formal. It's obviously not, a document or a framework, but I have found in my MPH experience that there is so much valuable knowledge and insight in the people I've interacted with, including my classmates, instructors, TAs, colleagues, and supervisors. I think this seems pretty obvious and we all know this intuitively, but as a student, and especially now with everything being online, it's easy to feel kind of alone if you don't understand a concept or if you're struggling with a skill. So my main point, I think, is don't be afraid to ask questions. I can almost guarantee someone else is struggling with the same issue. Like I mentioned when talking about the video resources, it can be really helpful just to have a concept explained in a slightly different way to have it click in your mind. I've been both the nervous student worried about saying anything in a group or a lecture, and I have been the student asking questions. I can say that I've only ever benefited from asking questions. It can also just be chatting with a classmate to get their perspective on a concept. Sometimes this might lead to someone sharing a helpful resource. I have gotten fantastic advice from my classmates so far in my MPH. In my experiences so far, it also seems like public health and EIDM cannot be achieved alone. There's so many contributing factors. There's always lots of people available. My time with the NCCMT has really highlighted the teamwork and communication importance to me. I've been able to see firsthand how the skills and work of many people are necessary to create and maintain various projects, and there's constant discussion, learning, and teaching occurring among team members. So this idea is really important beyond just the classroom, and I think practicing it while you're in a student role can be really helpful for future work experiences when you're part of a team. And there are absolutely times when independent learning is the most effective way to work through a concept. But just remember, if it's not working, you're a student and we're not expected to know everything in detail right away. There's a whole host of resources and teachers available, and connecting with other people can be one of the best ways to access those resources. And at the same time, you get their expertise or perspective on that resource. So to give an example, I had kind of a difficult time in the winter pinning down where I would want to apply for practicums. So during that time, I set up a meeting with my program director to brainstorm. She suggested some people to reach out to. Some of those contacts led to other contacts. Some were dead ends, but along the line, someone suggested the NCCMT to me. So that was something I was able to look into, and eventually was able to focus my efforts on seeking a practicum here. So even a conversation that doesn't end up where you might have expected, it's all really valuable for learning and networking. So I basically just wanted to add people in here to encourage students to talk to people that you find interesting and reach out to faculty and coworkers because they are there to help. And I'll pass it back to Emily.
That's awesome, Rachel. Thank you so much. I think it's really important to highlight the people aspect. We don't often think of people as a finite resource, but they absolutely are. And I have found in the public health community, everybody's been especially welcoming and willing to help and excited about the work that we do. So that's great. So thank you to all of our presenters for talking about the resources that they have found useful. We are actually right on schedule, which is pretty amazing for us. And what we'll do now is shift into the questions and discussion portion of this webinar. I'm going to give some time now for the people who are joining us. If you have questions, now's the time to type them into the chat window. Any comments are welcome as well. Our presenters are really fantastic resources. They've been very recently exactly where many of you are today, looking for practicum positions, looking for career positions, getting through their coursework. And I mean, some of them even landing some of these positions entirely online. Rachel, I think we interviewed Rachel just before the pandemic, so I was able to meet her one time in person. And then since then, she's been entirely online. And Alana, we've been working together for a number of months now, and we've never been in the same room. So it's definitely a different world now, doing practicum placements, starting jobs completely online. So any questions about that are absolutely welcome as well. So we do have a question here. The first question is, as an MPH student seeking a practicum, I'm wondering how you apply and potentially obtain a practicum at the NCCMT. Do we have one of our co-presenters who'd be able to chat about that?
I can speak to my experience. So I believe when I was looking for practicums, I came across the NCCMT posting within like the McMaster MPH kind of portal we have called Avenue. And so postings would be sent along there. And Emily, maybe you can correct me. I'm not sure if I remember it was on the actual NCCMT website, but I think I know that for me, it came through Avenue.
Yep. So we do have arrangements with a number of the MPH programs across the country where, at least for the programs that do compile practicum placement listings, we make sure that our listings are there. We realized how challenging it would be, especially during the pandemic, for people to be finding practicum placements. So we have committed to continuing to provide placement opportunities for students. So what you can do is keep an eye out if your university does put together those lists. And another thing you can do is simply email your cover letter and your CV to nccmt@mcmaster.ca. I'm going to type that into the chat window now. Oops, a typo, at mcmaster.ca. And we'll make sure that we get that to our practicum coordinator on our end. That's great. The next question was asking, will the presenters share their contact information for us to reach out to? That's a great question. I think probably the best way to handle that is for each presenter, if you're comfortable, maybe type your email address into the chat window, or if there's somebody, the person asking the question, if there is somebody that you're particularly interested in getting in touch with, feel free to email us at the NCCMT, again, that nccmt@mcmaster.ca, and we can then reach out to the presenter and see if they're interested in chatting as well. So presenters, if you do want to take a moment and add your email address, no pressure, of course, but if you are interested in connecting with students, feel free to add your email now. And the next question, according to the NCCMT COVID reviews, are they review papers? Not to take this away from the people who have been presenting. Actually, Emily W., you did work on this project for some time. Did you want to answer this question?
Oh, can you hear me now?
Yes, we can. Yep.
Okay, good. Sorry about that. So just to get this right, so the question, according to the NCCMT COVID reviews, are they review papers? Is that the one you're referring to?
Yes.
Yes. Okay, so I worked briefly on this as a research assistant at the NCCMT. And so they're rapid evidence reviews. So basically what they are is we're looking at a specific topic. And a lot of the COVID-19 research that presently has been done is very recent. So we're looking at very recent evidence on a specific subject that we may be looking at. So like I mentioned, copper was one of them. There's many others, and I put the link in the chat if you'd like to learn more. So they're not exactly review papers in the same way that you would think of a systematic review, which is way more in depth than looking at all of the literature on a specific subject that may have been done. These are more rapid evidence reviews where we're looking specifically at research that has been done fairly recently. Emily Clark, I'm not sure if there's anything you want to add to that.
No, that's a great question. So we started as closely as we could following the methodology in that rapid review guidebook, following as closely as we can a systematic review methodology. But of course, the methodology has to be tailored somewhat in order to meet the rapid part of the rapid review. We turn these around in usually about a week, so about 5 working days, which if you've ever worked on one of these reviews is a little crazy. So a couple of things that we have done to modify is we do limit our search to a number of the COVID databases. I would say we are fairly thorough in our search, but we do only check the list of databases that we have decided are the most fruitful for us to search. We do screening. We don't do the screening in duplicate. We have one person screen the search results. We do the critical appraisal of all of the results that we find. That was one thing that we were not willing to skip, and we really believe should not ever be skipped in a rapid review where decision makers may be using the findings to make important decisions for populations. So we actually make sure that we do in duplicate a quality appraisal of each of our included sources. And then all of those included sources are brought together using the GRADE methodology, capital GRADE. It stands for something like grading of evidence for recommendation, something like that. And it's a methodology where you can take both the level of evidence. So is it a double-blind RCT versus a case report? And the level of evidence is factored in, as well as the quality within that level of evidence in order to base the strength of your decision. So you put together your findings with then the caveat, we believe that this finding will change or is likely to change as more evidence emerges, or we're confident that this finding will not change as more evidence emerges. So we do have, there are a number of things that we do within those reviews to make them more rapid. They are not full systematic reviews, but we do strive to reach the highest quality that we can on that rapid timeline. So great question. And then a question, are NCCMT practicum placements available for those living outside of the Hamilton area? Now, 6 months ago, I would have said no. However, now with everything changing, we have moved completely online. I would say that yes, these placements are available for those living outside of Hamilton. Our most recent hire is actually working out of the Kingston area, and no reason to move to Hamilton anytime soon because we are still staying home from the office and working remotely for the time being. Great. We have a question. I see that there is a knowledge broker mentorship program on the NCCMT website. Is that for MPH master's students? This is a great question. Andrea actually was a participant in our second round of the knowledge broker mentoring program. This program is available not so much for master students. This program is available to organizations. So public health organizations like public health units or regional health authorities who are looking to change the way that their organization operates in terms of evidence-informed decision making. So the way that that program works is they send a small cohort or a small team to the National Collaborating Center, and they actually come on site, or they did come on site for workshops, and they do training, and then take that training and work on implementing that change then at their organization and changing the way things are done at the organization. So it's more of something for those organizations. That being said, we are just about ready to launch an online version of this program, again, available to organizations. And other things that may be more applicable that are similar are online learning modules. We are looking at developing like an advanced version of those. It would probably be, I think, fee-based, but there would be synchronous and asynchronous components there. And early next year, so starting January, February next year, we are working on an advanced online journal club. So for the past couple of years, we ran an online journal club. It's a webinar where we would do critical appraisal of journal articles together. And for people who are now ready to move on to kind of the next stage and, kind of like a train the trainer, so get them to start using that knowledge and skill to train their team members for critical appraisal. We will have I think a multi-week program online for those people. The next question is, what are some of the tasks and projects you're involved in during your practicum at the NCCMT? So for those of you who have completed practicums, feel free to chime in here.
Sure, I'd be happy to speak about this. And of course, this is Emily, by the way, so anyone who would like to know more in depth, please feel free to reach out to me by email. But some of the things and some of the different tasks that I completed as a practicum student at the NCCMT one of them was something that everyone does at the NCCMT, was doing critical appraisals on studies that are uploaded into health evidence. So this is something I continually do right now, and it gave me a really good understanding of the critical appraisal process. So I believe the link is put in the chat up above if you'd like to refer more to health evidence, but you can actually see the critical appraisal tool that we use at the NCCMT to appraise studies, and it's 10 questions, and you can look through that. So that gave me a really good understanding of critical appraisal. And also what we do is, myself, I'm a QA1. So I would appraise an article, and then someone who is a QA2 would also appraise an article. And then we would discuss any conflicts we have with any of the questions that we rated on. So that's one thing that you would work on as a practicum student. Another thing I did as a practicum student was, as Alana had mentioned, the Registry Methods of Tools that is on our website holds many different methods and tools in EIPH. So as a practicum student, one of my tasks was to work alongside some other colleagues in curating this registry. So a lot of the tools were a bit dated, And some of the things that we did was to find newer tools that had been updated, and also to make sure that we assigned every tool to the appropriate step in the EIPH wheel. So this is, again, where the EIPH wheel, having it there helped me a lot, because I was able to get a good understanding of it and look at a method and tool and be able to assign it to a specific step. And then as well, within that project, I'm bilingual. So I also took some time to be able to find some resources for the Registry of methods and tools that were offered in French. So our French users could use those tools as well. I'm not sure if anyone else who did a practicum would like to add anything to that.
I can jump in. This is Rachel. So I did my practicum with the NCCMT full-time from May through August this past summer. So it was really nice to be like completely ingrained in the day-to-day processes, and I was involved in several projects, just like Emily. So one of them was, of course, the health evidence QAs. Another project, which has been really interesting, it's still ongoing now, are the 2 systematic reviews. They're both related to COVID topics. So when I came in May, I was able to get started on the search strategy. So that involved a lot of like pulling apart the PICO question, figuring out what kind of keywords and mesh terms would apply to each of those concepts, and putting together search strategies, trialing them in different databases and tweaking them. We were kind of in conversation with a health sciences librarian during this process as well. So that was a great learning opportunity for me. And we've since gone through, the search, title and abstract screening, full text screening. One of the projects is currently at the quality appraisal level, and the other, we are, I believe, at the full text screening level. So that's been a really, really great learning experience to see the systematic review process and be able to contribute to it. My position, I've also been able to contribute in a smaller way to the NCCMT's rapid reviews. So my part of that has been a lot of kind of building the documents, getting the formatting and referencing all correct so that it's all consistent. And more recently, I've been a part of kind of disseminating it, getting it posted to the website properly, and making sure that information gets out to the public. Other jobs I've had to do, I got to do kind of a web development job with the health evidence website, and kind of going through and doing an inventory of each page of the site, so that we could kind of bring it back to a larger group and make decisions about what could be updated and what should be changed. Some other projects, I worked on a communication project that was essentially like an environmental scan of kind of media posts about public health during COVID and how public health is portrayed as important, as well as an impact report that had to do with NCCMT's impact over the last 5 years. So overall, a practicum placement with the NCCMT has been great because there are so many different tasks that you get to take part in. I really like that because it feels like a very realistic work experience rather than being working on one specific, single project. For the full summer, I really liked being able to kind of dip into a few different tasks.
Awesome. Thank you, Rachel. Sorry, I lost my microphone for a second before. Next question that we have is, does NCCMT offer jobs for students in general or just placements? I can answer this one. We do offer some contract positions, but I don't think we have offered those in the past to students. What you can always do is send a cover letter and your CV to our email address, nccmt@mcmaster.ca, with an outline of what you would be interested in. What we typically would be looking for was somebody who'd be able to help out with critical appraisal for things like the health evidence database. But again, I'm not sure if in the past we've ever had students. I think we've typically looked for graduates at that point. The next question that we have, and I also see that there is 2 questions in the Q&A, so I'm going to make sure that we touch on those 2 next. But the next one that I have here is, how is bias, such as racial, gendered, and class, accounted for or identified when appraising and synthesizing studies for reviews and best practice? Is there anybody who wants to tackle this one? So if not, I can take this one on. So it is very difficult to be able to account for this. Typically, research has a bias, unfortunately. A lot of populations who are researched are your middle-class, white, middle-aged men who are available to do these research studies and accessible to research. So this can, again, depending on the research studies, this can be quite a big bias in research. Women have been systematically underrepresented in medical research for decades. So in terms of appraising and then synthesizing those studies, it's really up to the person conducting the review to be aware of these potential issues in equity. There are some tools like the Progress Plus framework, Progress all caps plus. I think that will help you identify those types of issues to see how representative your sample may or may not be. There are various tools that are cited. So there's a lot of different critical appraisal tools for different research study designs. There were no tools that would evaluate data and information for the other, bubbles in that colorful bubble model for, community level evidence, community preferences, political preferences. The NCCMT we developed about a year ago, we just launched these, we call them the Quality Assessment of Community Evidence tools, CASE for short, QACE. If somebody has it handy, you can type in the link in chat. And those tools have a heavy focus on making sure that your the data that you're looking at is equity informed and that everybody is represented. And what I would say is really helpful is looking at, so on the back of each of those tools, it's like a 2-page PDF. On the second page are a number of different resources that you can look at in order to appraise things for representativeness and synthesize it with an equity focus in mind. The NCCDH for determinants of health also has some really fantastic resources that you can check out for that type of work. And it's nccdh.ca. Next question, I am going to flip over to the Q&A just because I've been focusing on the chat. Do we have any resources for relating these concepts to the public? For example, tips on communicating evidence to the public and educating the public on how to access or identify sound evidence. I don't want to, again, hog the presentation now, but what I can say for the NCCMT is that the public is not our target audience. According to our mandate, we are here to support and build capacity within public health across Canada. So our focus is on helping public health do this work. Now, that being said, some of the work that public health does is communicating this evidence to the public. So kind of yes and no. We do have a review that will be coming out, hopefully by end of day today, on risk communication. So we just did a rapid evidence review for our COVID-19 rapid evidence service on best practices for risk communication, with the target audience being people who work in public health and need to communicate risk, like how risky is it to have Thanksgiving dinner right now? How risky is it not to wear a mask when you're outside on a crowded sidewalk, that type of thing. So best practices for that kind of communication. So yes and no to that question. The public is certainly not our target audience, but we do try to provide resources to help public health reach their target audience, which would be the public. Does anybody have anything to add to that as well? Does anybody know about any resources maybe in the registry?
Yeah, I was just going to mention the registry again. It's Alana speaking. If you go to the registry on the left side of the webpage, you can just select the communication filter and it will show you all of the resources that we've compiled about how to communicate public health information during your knowledge translation work. So that might be a good place just to go to familiarize yourself with some of the tools that have already been created and are already out there.
Perfect. Thank you. I see somebody has asked about grade, and same answer, that grade is in our registry. So thank you for sharing that link there. The next question was, how do research topics get decided on for focus at NCCMT? So, I mean, there's a couple of different ways that we can approach this question. In terms of our COVID-19 research topics, on a weekly basis, we get the team together, and for all of the requests that we've received, we kind of, I mean, not formally, but loosely evaluate those requests and the research topics based on the newsworthiness. So how important is this question right now? How important is it to decision making? Do decision makers need this answer for making their decisions? As well as what type of research are we likely to find, or how much research is available? There's been a couple of times where we have started on a topic and had to scrap it because there simply wasn't any research available on the topic, or if it's a topic that is maybe too technical, like we did a review on serological tests for COVID-19, and it was kind of a miserable topic for us. It was highly technical and very much lab-based studies, which is not our strength, and we would rather do something where we can use our strengths and make sure that we do a great job. Is maybe somebody on the line who's involved in like maybe the systematic reviews or some other topics? Do you have any insight on how we decide those types of topics?
Sure. So I can talk about the systematic reviews that we're working on. Both are COVID-19 related. And when we were deciding on the topics for those, it was actually before I started with NCCMT, but they were kind of looking at areas where public health could maybe use a little bit of guidance. So with one of our systematic reviews, we're looking to focus on long-term care workers and how we can help with mental health interventions for long-term care workers who are now working through the pandemic. So basically looking at areas where there hasn't been a whole lot of guidance provided so far, and basically stepping in and looking to provide guidance for these long-term care workers. So I think for that, the process was just kind of looking to see what hasn't been done and which areas are super important and that we should try to help out with.
That's great. Thank you. The next question that we had was, is the online journal club for critical appraisal open to master students? Yes, it is open for master students and anybody working in public health. Going through the rest of the questions, I see a number of thank yous through the chat. I think we have actually reached all of those questions, as well as all of the questions in the Q&A. So if anybody has any last minute questions, please be sure to type them into the chat now. And you can always email our presenters who have provided their email addresses, or get in touch with the NCCMT at NCCMT at mcmaster.ca. We have a couple of things to wrap up. We're interested in your feedback for this webinar. Your feedback for this webinar is kept anonymous, but it does allow us to evaluate our program, as well as report back to our funder some of the impact and some of the changes that we've made. So in our first question, we're asking whether or not this webinar has increased your knowledge for evidence-informed decision-making. So please make sure that you select your answer and hit submit. whoops. And I believe I accidentally started the second polling question as well. So sorry about that, and please bear with me. The next question is about using the information from today's webinar in your own practice. So again, sorry for opening two polls at once. Alana, I'm messing that up for you. So skipping over to the next question there. We'll wait a few minutes here, and then you can select which of the following statements apply to your experience with the webinar today. Whether you found the webinar is relevant to the work and the schoolwork that you are doing, whether the webinar was effectively facilitated. We're especially interested in hearing about this with our new webinar platform. Whether there were opportunities for participation, whether it was easy to follow, and whether this met your expectations for the webinar. And then our last question is whether or not we can contact you in the future to talk about how we can improve our webinar series. And I believe that if you say yes, you will be prompted to add your email address, or which I think we might just trace it back to your registration. So I'm not entirely sure about that. My apologies. That's great. So thank you so much. We do have a link to our webinars page there. There is one last question here in the chat about what are good skills to make you a competitive candidate for a placement. My short answer would be EIDM. Get as many skills as you can for that as possible. Anybody else want to throw a quick answer in there as well for Miriam?
Hi, Miriam. It's Emily. Again, I'd be happy to speak more to this over email if you'd like. But I think something that helped me with this was to kind of understand the route I wanted to take in public health. So I think different practicums have different types of experiences that would put you ahead as a candidate. So whether that be more statistical-based knowledge or EIDM, as we've mentioned today, which I think is important in every aspect of public health. But yeah, I think one thing to be able to think about is just kind of what practicums you're looking at, and maybe when it gets to that time, there's many different webinars that are offered, multiple different public health organizations, or some courses like we hold here at the NCCMT that would definitely make you a stronger candidate when you're coming to time to apply into practicums.
Great. Wonderful. The link for the online journal club is the same as the link for the webinars, which is, I think, listed right below that question. Yes, I would recommend listing these certificates that NCCMT offers on a resume. I mean, I think that that demonstrates your commitment to EIDM and the practice that you have with EIDM. So I will wrap it up here. I want to thank all of our co-presenters for the time that you've taken to present with us today and the preparation that you have done. It's been really a pleasure to hear your perspectives on these resources that we have to offer. It's one thing to put the resources together, and it's another thing to hear about how they have actually been used. So this is one of my favorite webinars. This is a pleasure for me as well. So thank you to our presenters, Rachel, Emily, Andrea, and Alana. Thank you so much for taking the time to present with us today. And a huge thanks to all of the participants that we have with us today, the students, the faculty members that have joined us today. We certainly hope that this has been informative for you, that you are excited about some of the resources that we have to offer. And again, don't hesitate to get in touch with the NCCMT or with any of the presenters for some more information. We do wish you all of the best with your studies and with your programs, especially given the challenges right now. It's both a very especially challenging and timely time to be working in public health. So all of the best to you. Wishing you all the best. Stay safe and stay healthy. Thank you.